Well, this morning, our Kelsey Dorset spoke with Deputy Chief Medical Officer Kelsey Johnson, spoke with Deputy Chief Medical Officer Dr. DeLon Brennan.
So our latest case is, like you mentioned, a 66-year-old man. He'd had a history of international travel. He's a Bahamian resident, but he was known to travel internationally. Mostly, my understanding is to follow up on medical care. And he had been tested on another occasion and was found to be negative, but he was acutely ill, so went to the hospital and was tested at that time upon entry into the hospital and was found to be positive.
With the country's borders now being open for international and domestic travel, are healthcare officials concerned that they will see an influx or will be an influx?
I think for the healthcare side of things, we are cautiously optimistic that things will continue given the protocols that we have in place, that we'll be able to protect persons. We don't expect that we will not have any further cases of COVID-19. It's just making sure that we minimize the number of cases that we will bring into country. And the way to do that would be to continue to bolster our surveillance system, our contact tracing system, making sure that we know and have information on everyone who comes into country. Currently, our protocols in place mandate that everyone has testing that is done before they come. That is one level, but we also know that testing is not a panacea. What it does is say, for that very moment, it's a snapshot in time and tells you the person's not shedding virus, but anyone could be in their incubation period, and they could be early in their incubation period such that by the time they do travel to the Bahamas, they could be shedding at that time anyway. So it doesn't give you the level of protection to say you're just able to rely purely on testing before they come in. You need to make sure you still have those other parts of the system in place. And that's what we are taking the time and energy to ensure that we have those pieces in place right now.
Are we worried about the cases or the situation that happened on Arawak Key over the weekend and other partying scenes that happened or took place over the weekend in terms of seeing an influx or an increase in cases in the Bahamas?
I think our concerns continued even prior to allowing, places like an Arawak Key or other social events of that size to happen. We're concerned that people may not follow the types of public health measures that we are asking them to, and that concern continues. And evidence of what happened on Arawak Key is merely the opportunities for us to see where people are not doing it. And so I think we need to be stronger, not just in implementing those measures, but making sure that some sort of reinforcement, and whether that's inclusion or using, officers to be able to make sure that it's a true violation if people are not using it, and that people are, groups are broken up, places are closed down, and or there's a way for people to be able to access those, and mandating that if someone is going to operate a business and they're going to have customers and they're not using it, then you either have the responsibility on the owners or operators of those businesses to have things available for people to use, or make sure that our enforcement measures are stronger, because either way we can't slack off and not allow people to do the measures, because we know that will cause us issues down the road.
The World Health Organization just discovered that there are 2 strains when it comes to the coronavirus. Can you expand a little bit more on that for us, please?
I think as we learn more and more about the coronavirus and, the science gets better, we will see more of a delineation of the genetics of it as well. And so we've known of multiple strains of coronavirus for a very long time. This particular coronavirus, if you leave it around in nature for long enough, or once you discover it and you see it expanding in nature, you're going to see mutations happen. So it's an expected move to go along with it. I think what's going to be more interesting is really just watching to see, are there any differences between it, and are the treatments going to be different? When we start talking about things like vaccines, will you be able to use one vaccine, and will it be able to address, different mutations in this particular coronavirus? So, it's something that is of high interest to us in the medical and scientific community, but we're going to have to continue to watch to see how things progress.
The latest dashboard shows that there are 2 hospitalized cases. I know that the quarantine center is now closed. If we see a spike, can the quarantine center, or will the quarantine center be reopened, or are we going to put our healthcare providers at risk?
So there are no spikes, particularly when it comes to other individuals that we need to quarantine at present. And we have instituted both a contact tracing and quarantine system such that we have individuals in our surveillance unit and others that we have recruited into the contact tracing system that are going to be able to do in-person follow-up with those who are in quarantine. We were also using the Hubcat technology application to help us to reinforce some of the quarantine rules that go along with it as well. So that's our current approach. We're moving away from having, our own sort of quarantine facilities where we put people up, because that's an unsustainable model, a very expensive model as well. As you move forward, you're not going to be able to continue to hold that. Obviously, if there are instances where we need to put persons into quarantine, then the government and the Ministry of Health will find facilities to be able to do that. But we're hoping that we are not going to need large-scale facilities to do that moving forward.
There have been several outbreaks in the United States in terms of prison system and the coronavirus. Are we testing our prisoners? Are we making sure that they are safe?
We instituted a testing exercise within our correctional facilities, and so we tested healthcare providers, we tested the actual detainees, we tested people who were leaving and coming back out into society. And so far, we have not discovered any additional cases or outbreaks that have been going on in ours, but we continue to have syndromic surveillance going on within those facilities to ensure that if we see a spike in symptoms, then we'll have increased testing to ensure that we don't end up with an outbreak and cause a bigger issue in person who were forced to be in close quarters with each other.